I'm in the process now of figuring out if I'm going to have a preventative bilateral mastectomy, which is what most doctors recommend for a woman with this mutation. It's kind of a weird thing where usually you go to the doctor and they say, this is what you should do. But in this case, they recommend it, but you don't have to. I could do this surveillance for the rest of my life. It's kind of a personal choice. But if you have the preventative mastectomy, you reduce your breast cancer risk to almost zero. So
wow.
Yeah.
So from 80%
to
zero.
Almost zero. For the average woman, her lifetime risk of breast cancer is about 12%. And for women with the BRCA1 or BRCA2 gene, the estimates are all over the place. It's just so high. You know, when you hear like 80%, you know, you basically like, oh, so I'm probably gonna get breast cancer at some point. And you might not, that's the thing. There's a million other things that could happen to you before then, but those numbers they're scary.
You lost your mom to cancer when you were 19 years old. And your aunt died of breast cancer when you were in your mid-20s. So that's a lot in a short period of time.
Yeah, there's a lot. You definitely start thinking about your mortality a lot when you're, watching just these women in my life just, sort of dying one after another. And then knowing that I would like carry this piece of my DNA that is the same that they had. I mean, obviously a lot of my DNA is similar to theirs, but it's really, really hard. My uncle kind of sounded the alarm and said, what's going on in the family? There's all this cancer very young. So he recommended that my aunt and my mom get tested, and so it was found that they had this specific mutation on the BRCA2 gene. And so then I started learning all about what that meant and researching it, and found out that meant that I had a 50% chance of having this mutation. It was just as likely, I guess, that I wouldn't have it, half and half.
50-50.
But once you know the risk that it carries, my personality was, I just wanted to know. I just wanted to know, do I have it? Do I not have it? At that point, I think I wasn't even thinking clearly about what that would mean or what I was going to do. It was more just, do I have it? And, I want to know. So I actually just went to my gynecologist in my hometown and said, I want this test. He called me. I was at work, actually. I remember the moment very, very clearly. And I was a waitress at the time, working my way through college. He's like, it's, your doctor. And yeah, so your results are positive. You have this mutation. It's like,
this life-altering news.
Absolutely. And then I was trying to explain. I had a lot of friends I worked with, and I'm trying to explain to them, why I'm upset. Yeah. Right. And they're like, what? You have an 80% chance of getting breast cancer in your life? What are you talking about? No one knew what it was, and it was just very, very confusing and hard to deal with.
Your mom had already passed at this point.
She hadn't. It was a couple months before she passed away that I found out that I had it. So she did know, actually, and that's one thing that I kind of, I don't know if regret is the right word, but I kind of wish that I had waited, because I hate that she knew she had passed it on to me before she died. I think that was probably really hard for her to think about. Especially now that I'm older and I'm thinking, if I have kids, and you have to think about, do you want to pass on the chance of passing it on, even if it's not your fault, it still feels emotional, I sought out an oncologist who specializes in high-risk women, and so she sort of became my guide, I guess. She knows my body so well, so I think that's really cool to have someone that you've been going to for that long. She knows exactly what my breasts feel like. So if anything changed, she would know. It's been 10 years now where I see her twice a year for clinical breast exams. We check in, then she writes me prescriptions for MRIs and breast sonograms, and so every 6 months I have either a breast MRI or a sonogram, and then also the clinical breast exams. First of all, I'm always the youngest one, so everyone's looking at me, going in for breast MRIs and mammograms, what is that woman doing? And it's a little bit, it's just really stressful. And, you know, everybody's sick usually. You know, I'm like usually one of the only, because I go to like the oncology center. In the course of all of this, at some point, I think twice maybe, I had an MRI where they saw something. So then you have the stress of, well, they saw something, is it something?
Right. So you're probably just always waiting. Okay, is it this time? Is it this time? When's it gonna hit?
Right. And it's not, it's not preventing anything. They're just trying to catch it. It feels very strange to like volunteer for major surgery when you're healthy and happy and you don't feel like, I don't feel sick. I feel great, and you know, I'm being told by a doctor, you're gonna volunteer to do this thing where for 6 weeks you're not gonna be able to move, and you're gonna have drains, and your body's gonna look completely different. You know, like I have very small boobs. Can I talk about my boobs?
Yes, you should. This is called bare-breasted, girlfriend.
Okay,
of course
bare-breasted.
you should talk about your boobs.
So, you know, I have very small boobs. When I was young, when I was, you know, a teenager, I hated my body. Like, I hated my boobs. I was like, oh God, like, when are they gonna grow? Like, you know, and I think it's funny, like, through all of this and like dealing with just like breast cancer and it's funny, like, I feel like through the process, I've actually like become more attached to my boobs, because they're just like a part of me, and there's this like a whole genetic thing going on, and now I feel like sort of attached to my body, and like I don't want to alter it. Like
I guess it has to do with how intense the fear is.
Yeah.
And that only you can make that decision.
Yeah. Yeah, I think that eventually, I think I'm definitely leaning towards having the surgery. I think the fear's a powerful emotion. And,
yes, it is.
But it's funny, I'll like make a decision. I'll say like, yeah, like I just don't want to be scared anymore. I just want it to be over with. And then, you know, the next week I'll be like, well, you know, maybe. I think I would like to say that breast cancer is personal. And it's so different for everyone. And, you know, I don't even have breast cancer, and I have this whole experience related to breast cancer. And I just think it's important to remember that, you know, everyone's experiencing breast cancer differently, whether they're a caregiver or a patient, someone with a mutation, you know.
Thank you so much.
Oh, my girl.
Thank you.
Thank you.